Okay, let's start. Good evening, everyone. We are thrilled to have you all join us for the third episode of our Health is Well series. Today, we are honored to have three incredible speakers with us who bring a wealth of knowledge and inspiration. First, we have Tripurari sir, whose vision and passion for promoting holistic health have brought us here together today. Next, I would like to introduce Dr. Sharika Menon, a distinguished Ayurveda expert with over 16 years of experience at Sri Sri Tattva. She's a Nari Vaidya trainer and evaluator and trainer for Ayurveda, manual Panchkarma, Ayurveda therapies, and bodyworks, and currently serves as a consultant and research head at Sri Sri Wellbeing. Dr. Menon is also a teaching faculty for Ayurveda at the Sri Sri School of Yoga. Her global expertise shines through her work as a health and wellness consultant in countries like Thailand, Vietnam, Laos, Cambodia, Nepal, Malaysia, and South Africa, bringing a rich international perspective to her practice. And last but not the least, our moderator for today, Dr. Madhubala, who has completed her MBBS and has worked in rural medical services and CSR project with Exnora International in Tamil Nadu. As an allopathic doctor, she is deeply passionate about Ayurveda and is aspiring to pursue her master's in osteopathy and other holistic wellness systems. Let's dive right in with Dr. Sharika Menon and Dr. Madhubala. Over to you to guide us through this enriching session, doctors. Thank you.
Thank you, Apurva. Good evening to all. Thank you, Madhubala, for joining.
Yeah. Welcome you, Doctor, to the series of health education. We would like to start with queries on Nadi Pariksha. Being an ACE Nadi Pariksha consultant of the Sri Sri Tattva, could you describe how diseases are diagnosed in Ayurveda as per the science of Nadi Pariksha and its significance in modern day diseases treatment, Doctor?
So, I'm sure many of you are already familiar with this technique of Nadi Pariksha. So, this is a diagnostic tool that we use as an Ayurveda Vaidya. So, many a times to assess what is the condition of the disease, what level it has progressed, how is its, what are the changes or imbalances, what will be the prognosis, at what level we have to intervene and plan the treatments, whether it is medication or as a therapy, or maybe other aspects also, isn't it? Like lifestyle changes, mind related conditions. There's so many factors plays a role in healing, right? It's not about medication alone. So that holistic overview or that bird's eye view of all this, what is contributing to that illness, that clue we get from this technique, that is Nadi Pariksha. So as a regular practitioner of Nadi Pariksha, like we keep seeing that various aspects. So what correct intervention at right period, what needs to be addressed first, what can wait. So all that aspects we identify and address through this diagnostic tool. Of course, Ayurveda is not limited only to this Nadi Pariksha. It is one of the most profound techniques for diagnosis. There are many other procedures and techniques that we use in assessing and diagnosing a disease. So Nadi Pariksha is one among them, which was not very popular at one point of time. And with Gurudev's vision, it's become very popular. People are aware of it. A lot of people come to experience it. And even many Vaidyas who have not been into that practice, they've started learning about it and practicing it. So it is a very beautiful science. It's a science of its own. It's a lot of minute things that you need to learn in this. So it comes with practice, of course. And every time you practice, you feel we can know more. It's never enough. So that's how Nadi Pariksha is. So it is a very good. You can integrate this tool for diagnosis. It becomes it gives a lot of clarity to our treatment, even planning a medication, what intervention at what level, how it will help in the healing. So Dadi Pariksha gives a clear picture to that. And this is something which is very ancient school, of practice, which was, as I said, it was not popular. It can be learned only by the masters who have learned it and practicing it. And Gurudev has made it very easy to receive that technique to us. So, as a practitioner of Nadi, we have doctors all across India and across the globe who practice Nadi. And uh, it is something like, it is not just about illness, So, Nadi is not just something you need to do when you are sick. You can also do it when you are healthy as well, to keep track of things, how you are, how everything is under control or not. Anything that you need to bring attention to. Is it some imbalances could be through your digestive system or your eating habits, or something could be from the mind, aspects of the mind or stress, so on. So to identify that and keep track of everything and keep everything under a good balance, Nadi will help. So I would recommend, so somebody who want to experience it, it is best to keep doing it frequently, so that as we are talking about health and wellness, it is very important during this time that we keep some time for this. Everybody is focused on only on illnesses and imbalances and discomfort. It goes on and on. That seed develops in the mind too much, isn't it? And it will start manifesting. So it is best to keep that balance and to identify what are your tendencies. Some people know they have these tendencies. Certain food triggers an imbalance, certain activity triggers an imbalance. So to identify that, this is a very good way to do it. Yeah. And then sometimes certain things you feel it is normal to feel like that. You think that is normal, but then later on we understand it is not normal. It is progressing into a bigger issue as a disease. So all these small things can be easily picked up while doing this technique. No, when you go to a Nadi Vaidya, they will pick up all that, and then accordingly they'll give a remedy or corrections, in diet, lifestyle. Sometimes you need herbs and medication. Sometimes you need some other intervention like panchakarma or detox and so on. So that is how it works. So it integrates with all your sadhana, your dietary habits. Uh, it goes well with all that. Yeah.
Thank you, Doctor. It's actually very amazing to know about the science of Nadi Pariksha and how it has been revived. And I think all the doctors across various modalities are also being trained in Nadi Pariksha at Shri Shri Tattva, I think.
No, those who have inclination towards Ayurveda,
Okay.
and not like open for all, because you need to understand the basic principles of Ayurveda and understand that in order to practice it well. So there are few doctors who are very inclined to this such practices and sciences. Definitely they have come and learned. But mostly we have encouraged Ayurveda doctors to take it up more. Yeah.
Okay. Doctor, what is the role of Panchakarma and scope of it in diseases management, prevention, and control? And when ideally a detox needs to be done by any person?
So in general, as see, we cannot equate Panchakarma to detox. One of the benefits of Panchakarma is you get detoxed. So Panchakarma is a very vast term. It's actually 5 modalities, or 5 treatment uh, modalities that we plan according to the condition or whatever it's the disease require to treat, to be treated with. So as a detox, people may have require detox on a daily basis. We accumulate toxins on daily basis. So we say following a daily routine, like you follow a good meal times, you attend to your urges, you're attending to your digestive system, your mind. So the cleansing is happening on a daily basis. That is also a part of the detox. And then there are changes with the seasons, and then you keep accumulating unknowingly. So many things are accumulated in the system because of the seasonal variation. You don't change the dietary habits with the seasonal variation. You can stick to the same eating habits many a times, isn't it? So all that is accumulating toxins. And then mind also, these days we are all so busy with so many activities. Our lifestyle is, you as much as you can pack, you're trying to pack the day with all the activities possible. So unknowingly, at that level, mind level, stress levels, and all that is different. And then that is also accumulating toxins. Yeah. So to cleanse this, we have to work in different levels. It is not just about just cleansing the gut. Toxins can get accumulated at micro channels in tissues and anywhere in the system. So cleansing happens through meditation and pranayama and diet changes, fasting. So one of the aspects is panchakarma, where you need to cleanse the system in the, like, you go into the depth, little more intensive. So all the functional elements also are considered, organs and systems where the toxins are accumulating. Because when you accumulate such toxins, even stress, so all this impact our systems in different way, right? Respiratory system, your lungs, your liver, your gut. Gut is always under stress. Nowadays, so many people are experiencing 90% of the diseases. Its root is the gut. So to correct all these functions of these systems, panchakarma is very essential. And many a times we don't realize there is an imbalance or a disease that is developing unless it flares up like and manifests as a problem. You have pain or discomfort, then you go to a doctor. Right. So to ideally, panchakarma is recommended every season change or every year, once a year at least, so that you may have certain tendencies. You don't allow it to become a disease. So some people have always digestive issues, and then it doesn't mean that you suffer from digestion every now and then. You can take care of it, and then you can keep it under control for throughout the year. Yeah, but sometimes it can trigger once a while. So how do you manage that? That is something we can do with panchakarma. And in chronic conditions, it is different. In chronic conditions, we need to follow a particular plan. So the doctor has to take a detailed understanding how your imbalances have developed, what disease have developed, all those things, assessments has to be done. And then based on that, they plan it out. So sometimes it will be a combination of 2, 3 treatments. Sometimes it will be only one treatment. So panchakarma is not something you can just walk in and ask for a 5 days cleanse. It doesn't work like that. You need to prepare yourself for the treatments and then get the benefit out of it. Sometimes you need 7 days if it's a very small issues. But then if it is a chronic issue, you may require somewhere between 15 to 21 to 40 days, to work it out. So uh, this is how we plan. So seasonally also there is some changes. Every season we cannot plan like that. It depends on the condition, the person, the tendency, their prakriti. So many factors to it. So Panchakarma is like a very intense and you know intensive program, cleansing. So you have to be very relaxed at the same time. Then only the detox happens. You're busy. You just for time pass. If you're planning Panchakarma, it will not work. So your mind has to be relaxed. Your diet has to be taken care of. Very simple diet. There will be a certain specific diet that used to be followed, and then even the way your mind is involved in too many things. So all that has to be proper if you are planning a panchakarma. And panchakarma will work for many conditions. There are, of course, some people we cannot give panchakarma in certain conditions. That assessment the doctor will do when it is the right time to plan. Even those who cannot take panchakarma, there are other alternative ways to cleanse also. So it is not that everybody can do panchakarma. Uh, So this is how it works, and then it has to be done with somebody very experienced and proper. They know what intervention to do at what time and how to modify. There'll be, of course, body goes through so much of dynamic changes throughout the year, isn't it? Now, even through the treatment, also there will be some changes. So you may have to modify the medicines or treatment. It goes like that. It is very, what do you say? It is very specific to that person. It is not the same. Okay, that person got this set. I didn't get this set of treatment. It's not like that. It'll be different for everyone, depending on their condition, their body type, so many things into it. So Panchakarma, you can plan with a doctor. If you are a healthy person, at least once a year, you do it for rejuvenative and cleansing purposes. And if you already have some chronic conditions, then again, you need to work it out with a doctor, but you plan it, how you space it out, what treatment goes when. It goes like that. So you may have to take some time out for that. So that is how Panchkarma works.
Okay. Doctor, there is a lot of autoimmune conditions on the rise these days. How
Yeah.
effective is Ayurveda in treating autoimmune conditions and also conditions diagnosed as irreversible in allopathy, such as fatty liver, diabetes, thyroid issues, etc.?
Hmm. So maybe I'll focus on the autoimmune part first. So, see, autoimmune conditions, when we see any inflammatory response or any, so basically your body is fighting against itself, the tissues and all that. So, Ayurveda is a very beautiful way to look at it and understand what is the causative factor and working on that. And it has been managing very well most of the conditions, especially in that spectrum. So it looks into what is causing it, and of course, and you need a lot of patience uh, to work on this. And then once you get out of it, it's easy for you to maintain it with some simple changes. You will identify what food items gives you trouble, what lifestyle corrections you need to do. So all those things you understand. So you may have to work with a doctor for 1 or 2 years to reach that point, but then you will definitely start seeing the drastic changes within first 1 month or 2 months itself, just with simple medications. Again, coming back to the Panchakarma aspect, in even these conditions also, we introduce Panchakarma in certain times, so that body gets prepared for it. Whenever it is ready to go through a Panchakarma, we plan Panchakarma along with that. So then it responds very well, be it lupus related, rheumatoid arthritis, or any other condition, thyroiditis. So many things which is being, you can see it very common these days. And then people doesn't respond to all those medicines, and then they have to live with it. And for a long time, if you're continuously taking those things, one of the things I've observed is their metabolism becomes very bad. It affects very badly. And then once that is affected, it is very difficult for us to treat anything else. And then the side effects and then other comorbidities that they develop, all that extra, complications that they develop. So all this becomes difficult to treat. So even then, Ayurveda can help. But it is not like in one remedy, everything's sorted. There will be a lot of corrections that we need to make. People nowadays want quick solution. So, but then unfortunately, in certain chronic conditions, we need to give some patience you have to keep. Then definitely it will give you a lot of good results, a lot of good progress also. RA, we have managed rheumatic conditions, lupus, thyroiditis, I was mentioning about skin conditions, other muscular, skeletal, neurological conditions, and all that. And everybody is doing well. So you don't have to depend on anything strong medications for long term. Mm. And then coming back to other metabolic or lifestyle issues, certain conditions, yes, you once it progresses into a certain stage, you can only manage it. Um, it is very difficult to reverse it. But then there are conditions, even though it has become chronic, it is because of certain dietary or lifestyle issues that is not reversing. So once you start correcting that, support of some medicines, people have reversed also, especially thyroid, hyperlipidemia, all the cholesterol related issues, liver related issues, and even sugar, early stages and all, we can definitely work on it. But then long term, for several years, it has gone crossed certain stage, it is little difficult. But then Ayurveda can definitely manage it very well. So again, so chronic conditions, I want to add, chronic conditions, you cannot just depend on only medication sometimes. You may require some treatments on and off in between, so that sometimes when you see, when you start some medication, after certain period of time, you feel everything has become a stagnant. It doesn't progress further. You feel okay, it's not working. So that is the time maybe you may have to change the intervention, or you may have to introduce some detox so that the body start responding again. So all that only a doctor will be able to understand. You cannot say, oh, now it's not working. It's, of course, body gets there is some requirement of change or something. It is progress from that previous point to another situation. So you need to change the plan. So that is what happens usually in chronic issues, and then they keep changing doctor, shopping everywhere, you know, and then to get relief, then they'll say it's not working. So that is very commonly seen. Yeah.
It's good to know that Ayurveda has a broad range of treatment when it comes to addressing such chronic conditions. Regarding cancer, doctor, are we treating cancer in our hospital through Ayurveda? Until which levels our medicines can work and be treatable, doctor?
We have a cancer unit in the Shishi Ayurveda Hospital. We have a team of doctors there, headed by Dr. Nisha Ji, and then few other doctors along with her working for it. And many conditions they are supporting with not just Ayurvedic perspective, they integrate several other streams of medicine and alternative therapies, hyperbaric oxygen therapy and ozone, marma. So many, alternative methodologies. Yoga, pranayama is must. They have a protocol for your sadhana, daily sadhana for such patients. And then they will also guide with diet and other aspects also. So it is not just about medication. And it is also for those who are undergoing some treatments, cancer therapies, radiotherapy, chemotherapy. There is a protocol to support during the time. Post care also it is there. And then in between two sets of treatment, they also plan some detoxes and panchakarma as well. So it goes in stages. So before planning all the treatments and medications, we assess them thoroughly and understand the condition, and then only they design the plan. So you can connect with them online also. Whenever they come to ashram, they can visit the hospital and understand the details. Yeah.
Thank you, doctor. There are a lot of misconceptions and myths about the system of Ayurveda. Though its efficiency and brilliance in treating ailments has been proved since ancient times, there is still quite some misunderstanding associated with it. Could you address the commonly existing incorrect notions about it, doctor?
Two things that is coming to my mind right now is, first thing is it is very heating. So any medicine you take, you feel it's acidic and heat up and all that. It could be basically the dosage or the choice of medicine that is you took. So in case you feel that, you can always go back to the doctor and let them know this dosage is giving that discomfort, then you can correct that dosage. So it is not all medicines are like that. Ayurveda each herb has different qualities. Some are heating, some are cooling, some are drying, some are rejuvenating, and it increases the hydration. So many factors and all those nutrient compounds, phyto compounds, and all that. It that combined effect is what is we are seeing as a in that potency of the medicine, or what we say as how it is affecting on the system. So it is not like that. So of course, some medicines will give different effect. So the doctor will guide. And then if you over the counter, many people take medicine over the counter. Sometimes it doesn't suit them, and then they will find it, just because it is beneficial in certain cases, they take it long term. So that becomes a problem that can induce another imbalance actually. So that is another thing. And then another one more common thing I keep listening to is there is a fear of uh, having metals or all this hard, heavy metals in the compounds or the formulations that can bring toxins in the system. It's not so. Uh, Most of the formulations are very intelligently designed and produced so that it filters through the system very easily. It will not cause any damage, or it will not cause any, like, it will not lodge in the body like a toxin, so it filters out. There are so many studies that is being done. It is done before, even now, which proves that. So it is not something which causes toxicity like that. Of course, if it is not prepared well, that is a different case. You rely only on good brands which prepare good properly, and definitely it is effective that way. Even in Ayurveda, we have a section, specialization in Ayurveda, which we call as Rasa Shastra or Bhaishya Kalpana, where they design formulations and plan, how to prepare all the drug form it has to be used, what proportion it is to be, so many things. So they look into all that details and then formulate a medicine. So it will not definitely, even metals, each of the metal that is component that is used or mineral that is used, there is a way to purify it and make it edible so that you can absorb it and eliminate it also. So that is designed in such a way, and then it has come to the tablet form or liquids and all that. Of course, it is, I cannot say that Ayurveda doesn't have any side effects or anything like that. It depends on how you eat it. So that's why I don't recommend over the counter medications unless and until you are, you know what you are eating. Sometimes I've seen certain herbs, they take 3-4 months together in high doses, and it would cause some other ailments. So this is very common, I have seen in people. So you don't have to worry about these things like metal toxicity and effects like that. So that is another myth that I have seen very commonly. I don't know if do you remember anything else? Or you want to ask anything else with the common myths?
You can if you know more. I mean, have come across many other myths. But I generally, as an allopathy doctor, I've seen a lot of people bashing Ayurveda. Though I myself and many of my friends, we have been patients of Ayurveda at the end of the day to look forward to better health.
Uh, another thing which I remember right now is Ayurveda will take time to respond, to heal and all that. It is not so. There are medicines which will give you effect within seconds. Uh, it depends on the condition, what kind of disease you have. In acute conditions, we definitely have medicines to relieve in within seconds or within minutes. And then in chronic conditions, of course, it will take time to reverse it. The symptom, if you observe there is a change in the symptom within, you can see it within 1 week, 10 days, 15 days, you can see a huge change. So it's not like Ayurveda will take time. Right medicine, right formulation, or right combination, right way. If you are following all the do's and don'ts, definitely you're going to see changes quickly. Not you don't have to wait for 2 months, 3 months. Yeah, so that is another thing I just remembered. Yeah.
And Ayurveda always comes with the least side effects than any other modality, I believe.
It
So,
can be managed, yeah, it can be managed very well with least this thing. So there's that is what I'm saying. It's not like that. If you take it in the wrong way, it can have an impact in that way. So you have to be always careful, uh, always have a doctor who can guide you so that medicines also, if you take too long term, the same medication, it'll have an effect of like it is told like once you start eating certain food item that you gets used to it, your body gets used to it. Your body identifies like something you nourishes you and like a food. So similarly, medicine can also act like that. So you may have to modify it, change it a little bit. It works like that.
okay.
Mm.
Doctor, what are the treatments available at our Sri Sri Tattva Panchakarma and Sri Sri Hospital for general people, like for general people awareness?
So we have all modalities. We have all the departments. Uh, it's not, it has a very broad perspective, like from kids to mothers to preconception to post-delivery for all the other conditions like musculoskeletal issues, neurological issues, cardiovascular issues, gut issues, skin issues, eye. We have a separate special section for eye. Uh, we have experts taking care of all the eye conditions, and we are getting excellent results with that. Be it dry eyes to myopia to whatnot, all the conditions. So we have specialized we have departments specialized for addressing each of these conditions, and we have doctors also for that. So in both the Ayurveda hospital as well as Panchakarma, we have many conditions that we do. It's not just it is not just about detox or gut issues alone. In other conditions also.
And even surgical point of view, also Ayurveda comes.
Yes. So Ayurveda, we don't. We don't go to it into certain procedures. There are certain procedures we follow Ayurveda alone. Um, and then there are procedures where the doctors are trained as surgeons as well. That methodology is the same. Basically, when you see the father of surgery is ultimately Shushruta. Even modern surgery consider him as the father. So I don't know what is the difference modern surgery and Ayurvedic surgery. It's the same, similar. Even the instruments we see, it's all the same. Anyway, so one few things that I would like to emphasize here is about the Kshara Karma. Kshara Karma is certain procedure. We use certain medicated alkalis to treat certain conditions like anorectal conditions, fissure, hemorrhoids, fistula, and certain ulcers and all that. And then there are certain techniques that we follow in Ayurveda surgery to help in certain acute pain, including sciatica and low back aches and all that. So many conditions like that, we use certain modalities from the surgery perspective. Even in certain inflammation, certain skin conditions, we use it. So it's very fascinating that way. Even acute pain, certain pain conditions, chronic pain conditions also, there are certain procedures which we do. In one or two sittings, it helps. Yeah, one example I wanted to give here is tennis elbow. One person was suffering from that for many years, and then he's very fascinated by badminton, and it flares up and he cannot play. So many years he suffered from that. He tried everything, but it didn't work out. So one sitting of Agni Karma and one sitting of Rakta Mokshana. Rakta Mokshana is like bloodletting. In 2 sittings, he's out of the pain. He's over 2-3 years. He no longer has the pain anymore. No, he's cured of it. So this is even for Ayurveda. It's very fascinating to see all this quick results. It's not just something you have to keep doing and takes months together to repair it.
And especially in post-COVID arena, many people have realized the value of Ayurveda to revive their health as well.
Yeah.
And on this note, I would like to ask you, what is the scope of ozone treatment in post-COVID care? Could you throw some light on it?
So ozone therapy is being very popular nowadays, and then we have seen that it's any kind of oxidative stress in the system, any toxins that residual effect post COVID, any viral infections. Usually, when we see there is a lot of residual effect in the body, which affects different systems. It can be circulatory or musculoskeletal on the nervous system. People come up with many symptoms like that related to those. So, as a supportive treatment, when we do the ozone therapy, it's given a lot of good progress in healing. But especially with any changes in the blood tissue, that clotting mechanism and all that thickness in the blood, it was to help. It has supported that, and it has supported in all the aches and pains. It aids the healing. So along with other modalities, if you couple it along with it, it gives very good results. So it has to be done under a doctor's care only to identify what set of treatments will work. For example, some people develop anosmia, that they cannot smell. There is discomfort in the breathing, or even dryness or brain fog, and all that. There are certain simple techniques which helps heal that also. So there are different ways how the ozone is administered. So that needs doctor's consultation, of course, and then they plan it for you. Again, this also require few days. It's not like one session and then you are done with it. It may require few sessions, like a protocol, some 5 to 10 days or something like that to work on this.
Doctor, what are the general standard Ayurvedic routines that we can follow generally?
Oh, okay. So we talk about Dinacharya and Ritucharya quite a lot in Ayurveda. Dinacharya means daily routine, and Ritucharya means seasonal routine. So that is something which is very vast, and it may take another 2 hours to discuss about it. But then, so a few things I want to bring up here is, you watch your meal times. One thing you can correct is you can correct your meal times. That will have a very good impact on your gut and overall immunity and other. Even if you are suffering from some chronic issues as well, meal times are very, very important. You cannot keep it very erratic whenever you feel like you eat, especially late night dinners. So many people, that's become a habit that you eat and then you go to bed immediately. So it always ends up like 9:30 or 10 o'clock or something like that. So that's not a good idea. So it's always better to keep it away from your sleep. Even after waking up, no, in the morning, it's not that you eat first thing in the morning. So you wait for some time, give some few hours for the body to wake up and activate the Agni and all that, and then you eat. So these many people stick to a good routine. I agree with it, but then these days with the lifestyle, we don't bother about it. No, whenever you can, you eat. So that is one of the problems which can affect metabolism and in turn affect the immunity. So that's why dinacharya is important. So daily routine And this seasonal routine and all is recommended to maintain health. And maintain your immunity. So you can keep so many things off uh, your system. You have that resistance power, you have that strength to fight that. So these are the things that you need to do. So one is maintain the meal time, keep it away from the sleep, morning as well as night, and include some exercise, some activity, physical activity, yoga, and as well as workout, some kind of physical activity. We call it as vyayama, right? So that is must, walking or whatever you can. So that is also something which keeps the metabolism strong. And in turn, your immunity is also strong. Your sleep will be better. So many things will fall in place. Yeah. And then there are certain simple techniques that we practice on day-to-day basis to keep the health of your senses, eyes, nose, and all that. So, Nasyam is something which we recommend as a daily practice. But then, if you suffer from anything allergic, uh, sinusitis or bronchitis or any other conditions, you have to be a little careful. Don't experiment like that. So if it's a normal person, if you feel everything is fine, then Nasim is okay. But to start with, one simple way to do it is you take Anutailam. Anutailam is one of the medicated oils that we use for Nasya. Nasyam is like you introduce oil into your nostrils. So that you take it on a fingertip, just smear it on your fingertip, and then insert inside the nostrils and just smear it inside the nostrils, both the nostrils. So before you step out of the house, especially now, after the winters are over, everybody's falling sick. There's a lot of dust in the environment, pollen, and all that. That can aggravate. You catch some triggers very quickly. So this is to protect that nasal passage, that all the allergens and all the dust and everything is trapped there. This doesn't get into your respiratory system. And so this is something you can do every day in the morning before you step out of the house. Yeah. Or if you don't have Anutailam, at least little just pure ghee is also good enough. One drop of ghee, you just rub it inside the nostrils. That is also good enough. Yeah. And then there are many other uh, procedures, what you can say, techniques, daily practice techniques that you can do, but it needs some time. So these are a few things I feel you can start off right away, which will help.
I think these micro level habits bring about a change at the macro level body
Definitely,
in the long term.
definitely. I've seen a
And
lot of change like that. So people have started observing without even medicine, their elimination is better. Their sleep is better, digestion is better. So many things like that. Mhm.
I think it's high time that people educate themselves about the Ayurvedic way of life or the routines that they could follow.
Yeah.
And last question, Doctor. What are the other modalities of treatment available for a better health for a normal person, a common person seeking health, other than Ayurveda in holistic wellness system?
So in our center, we incorporate so many procedures and techniques from different parts of the world. So we have also um, incorporated, of course, yoga naturopathy is there. We have several massage techniques and like Hilot and Swedish and all that we practice in Panchakarma. Then we have special procedures like Marma. Marma is also part of Ayurveda, which is also something which aids healing. So many a times we don't know what has caused that pain or discomfort, or there is something long standing which doesn't respond to anything. So Marma plays a crucial role to heal that and help you start that process of healing. And then we have Meru Chikitsa, which is uh, a beautiful technique that helps with so many. It is like whatever is, what do you say? It reflects, diseases reflect in various ways. So that we it's like a tree, and then there is root to the tree. You work on the root, and then it will affect and heal the other things. So, like this, all these treatment modalities have its own effect, be it CST, osteopathy, Reikeno. Reikeno is another Japanese technique which helps in lymphatic drainage and so many other uh, conditions also. It will help. So one of the major effect is that. So like this, so many things can go hand in hand. And Ayurveda doesn't contradict with anything. It can go hand in hand with all these modalities. Yoga, be it yoga practices, dietary practices, all these alternative therapies. You can bring everything together. Yeah.
They say like where there is a will, there is a way, but here there is a platter of array of ways offered to any person who has any disease. So I think there is a lot of hope. I'm sure it would instill a lot of hope in people. Whoever hears this, that there is a lot of treatments available other than the conventional forms available now. And now that Guruji is bringing treatments from across the world, I think there is a greater scope of recovery as well.
Absolutely. And whatever helps people, um, you know, bring to that well-being, that balance, we must incorporate all of that, definitely.
Thank you, Doctor. It was very informative and valuable to have you here with us. And we are very grateful to your time and effort for sharing your knowledge with us. Thank you, Doctor.
Thank you, Dr. Madhu, for all the lovely questions, thought-provoking questions. Thank you.
Over to you, sir. Sir, I think you're not audible. So you're not audible.
आवाज नहीं आ रही है सर।
अभी आ रही है?
हाँ जी।
Is
यस,
it
आवाज नहीं आ रही है सर। यस, आ गई।
okay now?
Yes, sir.
अभी आ रही है?
हाँ जी।
Yes, sir.
Is it
आवाज नहीं आ रही है सर। यस, आ गई।
okay now? Okay. Relax. तो डॉक्टर
Yes,
सारे
sir. Yes, sir.
अभी आप लोग अपने आप को म्यूट कर लीजिए, मुझे मेरी आवाज आ रही है।
Yes, sir.
अभी आप लोग अपने आप को म्यूट कर लीजिए, मुझे मेरी आवाज आ रही है। Okay, now clear? अभी ऑडिबल? Okay. तो अभी हमने डॉक्टर सारिका मेनन जी से बातें की, जिन्होंने आयुर्वेद के बारे में छोटे से समय में सारी डिटेल दे दी है। सबसे पहले पंचकर्मा के बारे में बताया गया है। अभी हमने डॉक्टर सारिका मेनन जी से बातें की, जिन्होंने आयुर्वेद के बारे में छोटे से समय में सारी डिटेल दे दी है। सबसे पहले पंचकर्मा के बारे में बताया गया है। अभी हमने डॉक्टर सारिका मेनन जी से बातें की, जिन्होंने ओके, अभी ठीक है, अब नहीं आएगी दोबारा आवाज। तो सारिका मेनन जी ने पंचकर्मा के बारे में बताया। जैसे पूछा गया था कि डिटॉक्स की पद्धति है, तो उन्होंने बताया ये क्लेंजिंग प्रोसेस है, मतलब, और हर व्यक्ति को, स्वस्थ व्यक्ति को वर्ष में एक बार पंचकर्मा जरूर करवा लेना चाहिए, जिससे उसके चैनल्स खुल जाएं, एनर्जी के चैनल्स खुल जाएं, और छोटी मोटी कोई भी ब्लॉकेज यदि बॉडी में रहती है तो वो सब भी क्लियर हो जाए। पंचकर्मा इज एसेंशियल वंस ए ईयर, जितना मैं समझ पाया। दूसरा प्रश्न था पहला था नाड़ी परीक्षा। नाड़ी परीक्षा तो एक अमेजिंग फैक्टर है। पुराने समय में मैं भी वैद्य परिवार से जुड़ा हुआ हूँ, मेरे भी बहुत सारे लोग वैद्य रहे हैं। वो चेहरा देख करके बता देते थे कि इसका लीवर खराब है, इसका पेट खराब है, इसका ये खराब है। और कुछ मेरे घर में ऐसे वैद्य भी थे जो नाड़ी देख करके बता दिया करते थे कि इसको अभी ये डिजीज होने की पॉसिबिलिटी है। धीरे धीरे ये विद्या लुप्त हो गई थी, पर परम पूज्य गुरुदेव की कृपा से अभी फिर से ये विद्या फिर से हमारे व्यवहार में आने लगी है। नाड़ी परीक्षण एक ऐसा परीक्षण है जो विदाउट एक्सरे मशीन के, एक्सरे के अंदर में बहुत खतरनाक रेडिएशंस निकलती हैं, ऐसे मेरे एलोपैथिक डॉक्टर्स बोलते हैं कि भाई जहां तक हो आप एक्सरे ना करवाएं। बिना एक्सरे के आपकी पूरी बॉडी की सूचना सिर्फ नाड़ी परीक्षा से प्राप्त हो जाती है। नाड़ी परीक्षा वर्ष में एक स्वस्थ मनुष्य को 3 से 4 बार करवानी चाहिए। 2 वर्ष की आयु से अधिक के सारे बालक बड़े यस हार्मफुल रेडिएशंस होते हैं, और 2 वर्ष से उम्र से अधिक के जितने भी व्यक्ति हैं वो इसे वर्ष में 3 बार 4 बार करवा सकते हैं। स्पेशली जब ऋतु परिवर्तन होता है, जब हमारे यहाँ पर 6 ऋतुएं होती हैं, तो ऋतु परिवर्तन पर तो जरूर नाड़ी परीक्षण करवा लेना चाहिए, ताकि शरीर में 3 प्रकार के दोषों में से कौन सा दोष अभी बूस्ट हो रहा है, कफ पित्त और वात। डॉक्टर साहब ने ऐसा कुछ बताया है जो मैं सुन के याद कर पाया हूं, इतनी ही मेरी मेमोरी है, उसी हिसाब से मैं आपको एक बार स्पष्ट करने की कोशिश कर रहा हूं। कफ प्रकृति, पित्त प्रकृति और वात प्रकृति का पता लगने के बाद ही आपको औषधि दी जा सकती है। कोई भी औषधि आप डायरेक्ट नहीं ले सकते। यदि कहीं पर लिखा हुआ है कि त्रिफला खाना शुभ है, अच्छा है, लेकिन ये जरूरी है जानना कि आपकी प्रकृति के अनुसार त्रिफला सही है कि नहीं है, आपकी प्रकृति के अनुसार अविपत्तिकर चूर्ण सही है कि नहीं है, या कोई भी रसायन जो भी है। तो नाड़ी परीक्षा से पहले आपको ये पता लग जाता है कि आपके शरीर की प्रकृति क्या है। उसके बाद औषधि जब दी जाती है तो ज्यादा प्रभावी होती हैं। अगला प्रश्न जो था डॉक्टर साहब से, डॉक्टर साहब इफ आई एम समवेयर इनकरेक्ट प्लीज। हाँ, एक था कि ऑटो इम्यून डिजीज को लेकर के तो बहुत सारी पद्धतियां हैं, बॉडी अपने ही किसी पॉजिटिव ट्रेट को रिएक्ट करने लगती है। तो डॉक्टर साहब ने बताया कि आयुर्वेद के अंदर में एक छोटे प्रोसेस के बाद में, एक ट्रीटमेंट के बाद में इसे हैंडल किया जा सकता है। एम आई राइट डॉक्टर साहब?
Yes. Yeah. So it's a
Correct.
proper protocol.
जहां पर भी लगे कि मैं कहीं गलत बोल रहा हूँ, प्लीज उसको
Sure, no problem.
मे बी माई हिंदी इज लिटिल डिफिकल्ट, बट समझ में आ जाएगी।
Yeah, definitely.
क्या फैटी लीवर, डायबिटीज, थायराइड इशू रिवर्सिबल हैं? डॉक्टर साहब के अनुसार एक सर्टेन स्टेज के बाद में नहीं है। यदि इनिशियल स्टेज पर उनको डायग्नोस किया जाए और उनका ट्रीटमेंट किया जाए तो डेफिनेटली रिवर्सिबल हैं। साथ ही साथ आपकी डेली रूटीन, यानी कि आपकी दिनचर्या, आपको उन बीमारियों को हैंडल करने में बहुत मदद करती है। तो दिनचर्या के बारे में आपको संपूर्ण जानकारी एक एक्सपर्ट वैद्य से ले लेनी चाहिए। बिना उनकी सहायता के आप अपनी दिनचर्या सेट नहीं कर सकते। तो एक प्रश्न था जो मेरे को लगता है बहुत इंपॉर्टेंट था, और वो प्रश्न था कि हमारे हॉस्पिटल में कैंसर का ट्रीटमेंट होता है या नहीं। कैंसर का नाम ही डराने वाला है। किसी को ना हो और कहीं गलती से किसी डॉक्टर के मुंह से निकल जाए कि तेरे तो कैंसर के सिम्टम डेवलप हो रहे हैं, तो वो बिना कैंसर के मर जाएगा। इतना डर बैठ गया है लोगों के अंदर में कैंसर को लेकर के। मेरे भी कुछ मित्रों ने श्री श्री आयुर्वेदा हॉस्पिटल के अंदर में कैंसर को लेकर के कुछ उपचार लिए थे, और डॉक्टर साहब के अनुसार भी एक सर्टेन लेवल पर, सर्टेन स्टेजेस पर, कैंसर की स्टेजेस को स्टडी करने के बाद में और उसकी स्टाइल को जानने के बाद में कि वो किस तरीके से फैला है, आयुर्वेद के माध्यम से उसे हैंडल किया जा सकता है, आयु थोड़ी लंबी की जा सकती है। इज इट ओके डॉक्टर साहब?
Yeah, even if they are undergoing certain treatments, chemotherapy or radiotherapy, then also we can support them along with that. It's
हाँ,
not like Ayurveda standalone Ayurveda treatment. Standalone Ayurveda treatment भी होता है.
हम्म।
But this is also possible.
डॉक्टर साहब का कहना है कि सीधा आयुर्वेदिक इलाज भी लिया जा सकता है, लेकिन यदि आपने मेडिकली इलाज लिया है, उसके बाद में आपको कीमोथेरेपी चल रही है या कोई और जो उसको ओवरकम करने की थेरेपी चल रही है, उसको भी हमारे आयुर्वेदिक हॉस्पिटल में हैंडल किया जा सकता है। पोस्ट कैंसर सिचुएशन को भी हैंडल किया जा सकता है, ऐसा डॉक्टर साहब ने हमें सूचना दी है हमारे श्री श्री आयुर्वेदा हॉस्पिटल को लेकर। आप मेरे बैकग्राउंड में कंसल्टेशन नंबर देख सकते हैं 08061540300। तो अगला जो प्रश्न डॉक्टर मधु ने पूछा था हम सबकी तरफ से कि आयुर्वेद को लेकर के बहुत सारे मिसकॉन्सेप्शंस हैं। पता नहीं, सबसे बड़ा मिसकॉन्सेप्शन तो यह है कि ये बहुत धीमा इलाज करता है, बहुत स्लो है, स्लगिश है, धीरे धीरे लेना पड़ता है। मैं आपको बता दूं कि मैं एक आयुर्वेदिक फैमिली में पैदा हुआ हूं। जितना क्विक इलाज आयुर्वेद में हो सकता है, उतना शायद एलोपैथी में तो नहीं हो सकता, पहली चीज। दूसरी चीज, कुछ दवाइयां बहुत गर्मी पैदा करती हैं। जी नहीं, ऐसा बिल्कुल नहीं है। हर दवा की अपनी एक तासीर होती है, अपनी एक प्रकृति होती है, आपके शरीर की भी एक प्रकृति होती है। इन दोनों के अध्ययन करने के बाद ही आपको औषधि का प्रिस्क्रिप्शन दिया जाता है। हाँ, गर्म करने वाली दवाइयां मेटेलिक जितनी भी है, धातु से जो बनती हैं, आप लोगों ने नाम सुना होगा, स्वर्ण भस्म, भंग भस्म, है ना, अब्रक भस्म, ये सब जो मेटेलिक दवाइयां हैं, इनकी तासीर जरूर सामान्य औषधियों से अलग होती है। तो ये भी बिना एक्सपर्ट वैद्य के आप नहीं ले सकते। आप डायरेक्टली स्वर्ण भस्म नहीं खा सकते, आप डायरेक्टली भंग भस्म नहीं खा सकते। इसके लिए भी आपको एक आयुर्वेदिक डॉक्टर से परामर्श करना ही पड़ेगा। वो ही आपकी बॉडी को स्टडी करके रेकमेंड करेगा कि क्या आप इस भस्म के लायक हैं या नहीं। जहां तक मैं जानता हूं, डॉक्टर साहब को भी सुनने के बाद मुझे और कंफर्म हुआ है, जहां तक मैं जानता हूं, आयुर्वेद की सबसे अच्छी औषधि है काष्ठ औषधियां, जो हर्ब से बनती हैं। मैक्सिमम काम तो यही कर देती हैं। जो हर्ब्स मेडिसिन है, जैसे त्रिफला है या कोई भी चूर्ण है या रसायन है, रसायन तो नहीं है, लेकिन जो अवलेह वगैरह बनते हैं, वो चटनी जिसे आप लोग कहते हैं, ये ही मैक्सिमम प्रॉब्लम सॉल्व कर देती हैं। तो धातु पर तो जाने की जरूरत ही नहीं है। एम आई राइट डॉक्टर साहब? धातु वाली मेडिसिन ही गर्म करती होंगी मेरे ख्याल में।
No, it's like there are few herb medicines also. It can heat up the body. Like for example, turmeric. Turmeric, if it's a small amount, it's okay. But if you're taking too much, it has heated up. You know? So it depends on the amount also. It's not just the dosage, matra.
इसमें पता है डॉक्टर साहब ने कि जरूरी नहीं है भस्म ही आपको नुकसान करे या गर्मी पैदा करे। कुछ काष्ठ औषधियां, यानी जो हर्बल मेडिसिन हैं, वो भी एक निश्चित मात्रा के बाद में आपके शरीर में गर्मी पैदा कर सकती हैं। मैं बता दूं, काष्ठ औषधि उनका नाम है जिन्हें आप अंग्रेजी में हर्बल मेडिसिन बोलते हैं, उन्हें काष्ठ औषधि कहा जाता है। थोड़ा हिंदी ठीक कर दूं मैं अपने देशवासियों की, है ना, ये मेरी ड्यूटी है। अगला प्रश्न था, विच ऑल श्री श्री तत्व मेडिसिन कैन बी टेकन। हाँ, बिना प्रिस्क्रिप्शन के। वैसे तो देखिए, कोई भी दवा बिना प्रिस्क्रिप्शन के नहीं ही लेनी चाहिए, चाहे वो आयुर्वेदिक हो, चाहे वो एलोपैथिक हो। लेकिन डॉक्टर साहब के अनुसार बिना कंसल्टेशन के दवाई लेना किसी भी दृष्टिकोण से उचित नहीं है। इस उत्तर को मैं थोड़ा ढंग से सुन नहीं पाया था, तो मैं रिक्वेस्ट करूंगा डॉक्टर साहब से कि डॉक्टर साहब इस प्रश्न पर आप जिस भाषा में भी चाहें एक बार फिर से प्रकाश डाल दें।
So any medicine is always a medicine. It has to be you have to decide the dosage, when to take, how to take it, with what you take it. All that is important. So many times people take over the counter and then they don't find any effect. Then sometimes it will lead to other problems also. There's always, even if it is a herbal based medicine, it is always right to talk to a doctor and understand what suits. So there will be 3 medicines that can be beneficial for you. I know it can give the same effect, but then what is the best choice out of the 3? You cannot take everything together. And then sometimes mixing 2-3 different medicines because they have different energies or potencies. You cannot mix them together. So all that a doctor will be able to guide it better. So that's why it's best to not to take over the counter.
डॉक्टर साहब के अनुसार आप सीधी कोई भी दवाई ना लें, हर दवाई की अपनी अपनी एक ऊर्जा होती है। यदि गलती से दो ऊर्जा मिक्स आपने कर दी तो उसके रिवर्स इफेक्ट भी देखने को मिल सकते हैं। तो आप काउंटर से सीधा खरीद कर दवाई लेना शुरू ना कर दें। हो सकता है इनके कुछ परिणाम आपको परेशान करने वाले हों। तो विदाउट कंसल्टेशन डू नॉट टेक मेडिसिन। डॉक्टर साहब के अनुसार दवा तो दवाई है, चाहे वो आयुर्वेदिक हो, चाहे वो एलोपैथिक हो, चाहे वो होम्योपैथिक हो। ये मैं अपनी तरफ से बोल देता हूँ बाकी पैथी के बारे में। एक क्वेश्चन और है, व्हाट आर द ट्रीटमेंट्स अवेलेबल इन अवर श्री श्री तत्व हॉस्पिटल? डॉक्टर साहब ने बहुत अच्छे से बताया, शायद ही कोई मर्ज ऐसा बचा है, शायद ही कोई रोग ऐसा बचा है पृथ्वी पर जिसका इलाज हमारे श्री श्री आयुर्वेदा हॉस्पिटल में नहीं हो सकता। डॉक्टर साहब ने जरूर आई स्पेशलिस्ट आईज के ऊपर में बहुत कुछ कहा, पेन्स के ऊपर बहुत कुछ कहा, लेकिन जब जब मैंने विजिट किया है, मैं लगभग 3 या 4 बार विजिट कर चुका हूँ। डॉक्टर प्रेम उन दिनों में बड़े फेमस हुआ करते थे, डॉक्टर ज्ञान उन दिनों में बड़े फेमस हुआ करते थे। In those days, I used to go to hospital and it has all facilities, whatever you want. It has all kind of treatments over there. डॉक्टर साहब ने तो बता ही दिया, आंखों का है, दांतों का है, पेन का है, मसल्स का है, सब तरीके के इलाज वहां पर उपलब्ध हैं, सब तरीके के उपचार वहां पर उपलब्ध हैं। अब आप सोच लीजिए, यदि कैंसर को ट्रीट किया जा रहा है तो दुनिया में सारे बीमारियां उस कैंसर से नीचे नीचे ही मानी जाती है। ठीक है, कुछ बीमारियां ऐसी है जो वेस्टर्न कंट्रीज में पाई जाती हैं, हमारे यहाँ नहीं पाई जाती हैं। तो वो मेरे को नहीं लगता है कि हम लोग उनको ट्रीट करते हैं। नाम सुना था मैंने माइस्थेनिया ग्रेविस, जो अमिताभ बच्चन को था, तो अभी पता नहीं उसका इलाज होता है कि नहीं होता इंडिया में। ठीक है डॉक्टर साहब, इज इट ओके? करेक्ट? ओजोन ट्रीटमेंट के बारे में एक प्रश्न था। मैं कम ही जानता हूं क्योंकि कोविड के बाद में मेरा डॉक्टर हॉस्पिटल में मिलना बहुत कम हुआ, लेकिन मेरे परिवार के कुछ सदस्यों को मैंने ओजोन ट्रीटमेंट के लिए सजेस्ट किया था, मेरा बेटा और मेरी धर्मपत्नी दोनों को ही। और मैंने देखा कि उनके अंदर में बहुत बहुत चेंज है। बेटे को एलर्जी टाइप का कुछ था, काफी कंट्रोल्ड है। ये ओजोन थेरेपी जो भी है, ऑक्सीजन शायद इंजेक्ट किया जाता है बॉडी में इन वेरियस मेथड से। तो ओजोन के बारे में मैं ज्यादा कुछ नहीं बता पाऊंगा। इफ डॉक्टर साहब कैन अगेन से इफ शी हैज सम टाइम टू एलोबरेट इट, देन इट्स ओके। अदरवाइज जो डॉक्टर साहब ने कहा वो याद है तो अच्छी बात है, बट मैं फॉर द ऑडियंस सेक आई वुड लाइक टू रिक्वेस्ट डॉक्टर साहब once again tell something about ozone therapy.
So ozone is like a different form of gas. It's something which helps in what do you say? See, many times healing doesn't happen very easily. The tissues are under stress, and the response for the body to heal, that trigger that gives to push it a little bit to heal it faster. That is what ozone therapy is doing. So many times post COVID, it's not just about COVID. Many conditions, viral infections, and all that. There's a lot of impact on circulatory system, on the blood, in the nervous system, muscles, all the tissues gets under stress. There is inflammation, and then what happens is that healing slows down. There is a lot of wear and tear. There is a lot of imbalances that can happen. So to push that healing faster, to reverse that, ozone is helping very well. Like a nutrition, even the nutrition absorption, everything improves. And then that's what it is doing, to put it in a simple word. So we incorporate it along with many other modalities also. It is not just standalone. It can act standalone as well. And we do it along with Ayurveda as well. So it could be allergies, there could be inflammations, pains, long-standing pain or wear and tear in the tissues. It could be circulatory issues, where the blood is thickening, and so many things like gut issues, if there is any allergic response or inflammatory response. It could be allergic response in the respiratory system. Some people feel there is weakness in the nerves with the hearing or the smell. So many things it helps. Yeah.
सबसे पहले मैं डॉक्टर मधु, जिन्होंने इस प्रोग्राम को मॉडरेट किया बहुत सुंदर ढंग से, और उसके बाद मैं डॉक्टर सारिका मेनन जी को धन्यवाद देना चाहूँगा कि छोटे से समय में गागर में सागर भर देना, हमारे हिंदी में से कहा जाता है गागर में सागर भर देना, कम समय में ज़्यादा इंफॉर्मेशन प्रोवाइड करना। तो मैं आप दोनों को बहुत बहुत धन्यवाद दूंगा, और जब भी मुझे आवश्यकता होगी फिर किसी इशू पर, तो मैं चाहूँगा कि डॉक्टर सारिका मेनन जी फिर से हमारे लिए समय निकालें, ताकि और भी बहुत सारे इश्यूज पर हम चर्चा कर सकें।
Thank you so much for inviting me. It was very nice questions that you have put together. So that this is very common questions that we come across, and it is very essential to bring this information to everyone. Very nice, wonderful team, and wonderful.
Thank you, Dr. Saab. Thank you, Madhu. You are always best. Thank you.
Thank you, sir.
Thank you.